Hello, my name is Hailey Harris, and I am a second-year medical student at the Duke University School of Medicine. During the recent and ongoing COVID-19 pandemic, our health system created a specific clinic for all pregnant women with presumed or diagnosed COVID-19 infections. This presentation will discuss our objectives, methods, and results from this project. This study would not have been possible without the efforts of faculty in the Duke Department of OB-GYN who developed and staffed the COVID-19 clinic, and I would like to acknowledge them for their work in support of this project. We all know that pregnant women with COVID-19 symptoms, exposures, or a positive test must be quarantined. However, during this time, routine and necessary OB care should continue. This can be challenging to accomplish while trying to ensure that the patient, other patients, and providers remain unexposed. Thus, in this study, we sought to demonstrate the feasibility of a cohorted COVID-19 obstetrical clinic. This concept would allow for a select number of providers to become experts in donning and doffing personal protective equipment and in managing COVID-positive patients. This strategy served as a model for other clinics within the 3-hospital health system. In addition, we wanted to gather data on demographics, pregnancy complications, and outcomes for patients with COVID-19 exposures. Our methods involved developing a separate location for patients with diagnosed or presumed COVID-19 infections to receive obstetric care. The clinic is staffed by a trained OB-COVID team, including 2 medical assistants and/or nurses, and 1 maternal fetal medicine specialist. Next, we conducted an IRB-approved retrospective chart review of patients seen at the COVID-19 obstetrical clinic. Finally, we used simple statistics to analyze the data and examined demographic trends in exposures, positive infections, and outcomes. Between March 18th and June 22nd, 2020, there were 54 women seen in the OB-COVID clinic, of whom 35 tested positive for COVID-19. Latinx women were more likely to test positive for COVID than other racial or ethnic groups, as seen in the table. Of 43 patients with exposures, 15 were family-related, 13 were work-related, 2 were travel-related, and another 13 had unknown exposures. Of those with known exposures, those with family-related exposures were most likely to test positive, with an 80% positivity rate, followed by work-related exposures, with a 69% positivity rate. Among the 35 COVID-positive women, 2 were asymptomatic, 29 had mild symptoms, which was defined as illness that was manageable at home with no major comorbidities. 3 had moderate symptoms, which was defined as infection with evidence of lower respiratory disease by clinical assessment or imaging with oxygen saturation greater than 93% on room air at sea level. 1 patient had severe disease, which was defined as illness with more than one of the following criteria: oxygen saturation less than 93% on room air at sea level, respiratory rate greater than 30, ratio of arterial partial pressure of oxygen to fraction of inspired oxygen less than 300, or lung infiltrates greater than 50% on imaging. 4 patients required hospitalization, one of whom was asymptomatic but had lab abnormalities. Length of stay ranged from 2 to 6 days, and 2 patients received the experimental drug remdesivir. No patients have developed growth restriction, and 13 of the women have delivered. In conclusion, a cohorted obstetrical COVID-19 clinic is a novel risk mitigation strategy for pregnant COVID-positive patients and develops experts in donning and doffing personal protective equipment while ensuring COVID-positive patients receive consistent obstetrical care. Thank you so much for your time and attention. Please direct questions to hailey.harris@duke.edu. You can also scan the QR code on the first slide for a link to the full abstract. Thanks.